According to the CDC, cases of whooping cough, also known as pertussis, are on the rise, especially among young children ages 2 to 4. According to the CDC, as of October 5th, more than 17,000 cases were reported compared to just 3,900 cases around this time last year. That's 5 times as many cases. Dr. Nihdi Kumar is on call. She says awareness, prevention, and early treatment are key to beating this illness. Good morning.
Good morning.
What exactly is whooping cough and who is most at risk?
Well, it's a respiratory bacterial infection, causes fever, sneezing, stuffy nose, and that cough with that characteristic whooping sound. And what that sound is actually a gasp for air. Because what makes this so dangerous is this whooping cough, which is the bacteria pertussis, causes a huge amount of inflammation in the airways. And for little kids, those really little kids, their airways are small. And that inflammation can actually cause difficulty in oxygenation.
Why are we seeing such a dramatic rise in cases, do you believe?
Well, I mean, this is one of those residual fallouts from COVID. You know, during COVID, we switched to telehealth and we really became behind in our vaccinations. Now, getting vaccinated for whooping cough is incredibly effective, but you need 5 vaccines before the age of 7. And we're seeing a lot of kids that are behind in their vaccinations. Teenagers need a booster, and adults need a booster every 10 years. So as a community, we are really behind in getting fully vaccinated.
And what are some of the signs to look out for that a child is in danger?
Well, we want to look for difficulty breathing and low oxygenation. And for those little kids, they can't communicate to you. So you're looking at physical exam finds. Do their lips look bluish? Are they acting as if they are in distress? Are they using their chest muscles and their stomach muscles to breathe? Are they having coughing fits, making, again, that characteristic whooping sound? Are they not eating or drinking well? And then finally, you know, if something just doesn't feel right as a parent, err on the side of caution, visit your healthcare provider.
And finally, how do you go about preventing and treating whooping cough?
Well, vaccination is key. Get yourself vaccinated. Pregnant women need to be vaccinated. Young children need to be vaccinated. But here's where we often forget. It's the older adults. Grandparents, aunts, and uncles, you know, can contract whooping cough, and the symptoms can be mild, and then they can pass them on to their younger family members. Get vaccinated. Early antibiotics work incredibly well, will shorten the course of that contagious period. And then watch the household triggers. If you have somebody that's sick in the household, avoid the dust, the smoke, the chemical fumes.
Dr. Nihdi Kumar, cardiovascular disease specialist, thanks so much for joining us. And you can see Dr. Kumar's segments every Monday at 7:15.